Thank you. It's a privilege for me to be back down at the coast. I was up in Virginia and West Virginia over the weekend. And last week we were over in the furthest corner you can go in North Carolina. And so, but I always like to get down to the coastal area as often as possible. I got up at 3:30 this morning so I could get down here and join you today. But thank you all for having me. I want to thank the mayor. I don't know where she was. She was back earlier for being here. Mayor Davies and Chief Tilley's here. Thank you for being here. And John Rizzoli, Fire Marshal, thank you for being here. And I just want to take a few minutes and tell you some of the things that we do. We've got a lot of SHIPP volunteers in the room. I want to thank everybody that volunteers their time for SHIPP. As I travel across the state, I make it a point to stop in and visit our SHIPP volunteers as much as possible. Last week we were down in Greene and Lenore counties in eastern North Carolina, and I recognized a lady that had been a SHIPP volunteer for over 31 years. So we have some very special SHIPP volunteers that devote their time to helping senior citizens all across this state. When I try to get out of Raleigh as much as possible, Chief, and visit as many fire departments as we can, because I live in rural North Carolina. I live on the same farm where I grew up. I'm fifth generation farmer in southeastern Guilford County. And so I know what hard work is all about. Any of you all that grew up on a farm, you know what I'm talking about. But I try to get out of Raleigh at least 2 or 3 days a week and visit with our fire chiefs, our sheriffs, and our elected officials across the state to talk about their local issues. But you'll be surprised how many people don't even realize insurance commissioners in elected office. And very few people can tell you the name of the insurance commissioner in North Carolina, because it's one of those offices that you really don't think about, but it affects your pocketbook every day. And when you ask people, can you tell me what's under the Department of Insurance, almost nobody can tell you all the things that are under that department. Now, the people in the fire service know, but a lot of other people don't realize the insurance commissioner in North Carolina is an elected office, just like the governor, lieutenant governor. I serve on the council of state with the governor, lieutenant governor, and those other 8 council of state. We meet every month. And anything the state does when it comes to buying property, selling property, leasing property, it all has to be voted on by the council of state. But outside the fire service, not everybody knows that I'm the state fire marshal. And we're also the chief building inspector for the state. So we're over the state building code, engineering codes, and all of that. I do have a background in civil engineering, construction management, and spent a couple of years working for a major general contractor, but I got recruited into the insurance business, and most of my career was in the insurance industry. The insurance commissioner in North Carolina also regulates collection agencies. Not many people realize that. We regulate continuing care retirement communities. We regulate bail bondsmen, surety bondsmen. How many of you know we have law enforcement? North Carolina was the first state in the United States to set up law enforcement in a Department of Insurance, and that was back in 1945. And when I took office, I was sworn in at a fire department because I wanted to show my support for the volunteer fire departments across North Carolina. I was sworn in a minute after midnight at the Gil-Rand Fire Department at the Guilford-Randolph County line that serves both Guilford and Randolph counties. But the first place I went after I met everybody in the department, the first week in January 2017, was to sit down with our criminal investigations division to find out how bad is insurance fraud in North Carolina. And I knew it was bad. It was just worse than I thought. I was informed that every month the Department of Insurance receives between 400 and 500 serious criminal complaints that need to be investigated. When I asked how the department was doing when it comes to investigating nearly 5,000 serious criminal complaints a year, they weren't doing that well. They were only investigating about 12%. So to me, when you had 88% of almost 5,000 criminal complaints going unanswered, that's a problem. The second place I went was to the Office of State Fire Marshal. And when I travel this state, and I've been in every county multiple times over a lot of years, I've had chief after chief say, I can't remember the last time when we saw anybody from Raleigh. I can't remember the last time this fire department was inspected. And so nobody seemed to have a handle on how often we're inspecting our fire departments. That's sort of important because wherever you live in North Carolina, the rating that your local fire department has a direct bearing on what you pay for homeowners insurance in that fire district. So in case anybody's interested, we have 1,351 fire stations in North Carolina spread across 100 counties. And when I got that list of that 1,351 fire departments, I'm sad to say that I was shocked again when we had fire departments in the state of North Carolina that hadn't been inspected in 25 years. There was one down in Craven County outside of New Bern, hadn't been inspected in 28 years. Now that's unacceptable, and I said, well, what's the problem? Well, the problem was pretty simple. They only had 5 fire department inspectors to cover 100 counties with 10.5 million population in this state. And I said, well, that's a simple solution. We need to hire more fire department inspectors. The other thing was getting these arson cases and criminal insurance fraud cases pushed through the courts. It was sometimes taking way too long. So I said, what we need is to hire a prosecutor to help prosecute these cases, work with the district attorneys. So I hired a lady that was a prosecutor for 10 years, and I said, you got one job, and that's to work with the district attorneys in every county and move these fraud cases, arson cases through the courts. She said, I need 2 more attorneys, one for the west, one for the east. So we generate a lot of money to the state. We bring in revenue from insurance licenses, all types of licenses, fines and fees, and this in the neighborhood of approaching $700 million a year. I think it's soon going to hit $1 billion that we bring into the general fund. So I thought it'd be easy, Perry, I thought it'd be an easy sell to go to the legislature and say, we need to keep a little more of our money. So I went to the legislature, I went to the speaker's office, and I said, look, I just got here, but I'm going to tell you, we need more people and we need more funding, and we need it last week. And they said, well, we'll help you, but don't come back over here asking us for 30 new positions. I didn't. I went back over and asked them for 78 new positions. And they looked at me, Perry, they said, I thought you were conservative. I said, well, it's like this. We're all paying for this fraud. We're paying 15 to 20 cents on the dollar for every dollar we pay in insurance premiums are going to cover insurance fraud. So you either go after the fraud or you keep driving your insurance rates up, which are already sky high in many parts of the state. So I'm happy to report that when that budget passed last summer, they didn't give us everything we asked for, but I got 42 additional positions. And in the past year, I've hired 3 new fire department inspectors. 2 were former fire chiefs, 1 a former fire marshal in the county. We have whittled down on that backlog to, I think now the furthest behind we are on inspections is about 10 years. I brought in the 3 attorneys to set up the legal prosecution team, and we have doubled the number of criminal investigators that are out across this state in the past year. We swore in 18 law enforcement on one day at the Supreme Court earlier this year. We're getting ready to bring on 7, in fact 7 more just started today. We're going to swear those in this coming Friday. And I could probably use 30 more, but you have to take it a little bit at a time. But we made 437 arrests last year for insurance fraud. We already surpassed that this year. We'll probably double it. And that prosecution team is doing great work working with district attorneys. But that's more than you wanted to know. I just wanted to give you an overview before they cut me off. But I want to thank all the SHIPP volunteers. And Miss Melinda, if you'll come up here and help me, I want to recognize the SHIPP volunteers that are in the room today. She's got my list, so this is the Vanna White of the Department of Insurance. So call them up.
All right. Well, thank you all for being here today. I am Melinda Munden, and I'm the SHIPP director for the Department of Insurance, and I'm so proud. Thank you, Commissioner, for coming today. And the foundation of SHIPP is truly its volunteers and how they support the people all across this state. And I'm very excited that we have folks not only from Dare County, Commissioner, but from Currituck as well. So with that, I want to start with what we call the coordinators at these centers. So earlier, I want to say real quickly, Emily Gould is the coordinator here at the Baum Center, and for Dare County, Brandy Rubottom. I always say she was a former, but she's still involved. So thank you for that. Sandy Scarborough with the Dare County Center. She's not here? Okay, but I still want to say her. We'll say thank you anyway.
Thank you.
Right. How about April Bodiford?
Who's here?
Fessenden Center. Thank you for that. Jessica Gibbs. I'm going to say this wrong. Madam Mesquite. Did I do it right? Thank you. Thank you. Jessica's pretty new, Commissioner, so we're...
Did you say Madam Mesquite?
Did I say it right?
She's got her own lake.
She's We were joking real quickly. I'll say this. I am not a native North Carolinian, but I've been here a long time, and I always chuckle when I'm driving down the road and see names of towns, and it's Canida, and whenever there's somebody, I'll say, how do you say that? Conato? Or Canitney? There you go. Olivia Jones is our Currituck coordinator. And then I want to go ahead and make sure I recognize the volunteers. Sheila Mitchell from Currituck. Is she here? If not, thank you. Oh, Sheila? Here. Is it Everly? Evanly? Hanley? Evelyn, thank you. It's my poor penmanship. You're fine. Mike Eubank? It's from Dare County. Thank you. Cindy Harris. Thank you. Mary Ellen Holland. Thank you. Bella Reber. Thank you. And Christine Rusticus, or Rusticus. I see I'm saying all these names wrong. And Commissioner, that's just a small portion of, actually, we have 16, I know, here in Dare County alone.
Yeah, thank you so much. And don't go anywhere because I'm almost through. But we have almost 1,000 volunteers all across North Carolina in all 100 counties. But in closing, I just want to say the main message that I want to give to everybody about the Department of Insurance is whatever area you may have a question about, we're here to help. We have great people right now on the phone, 8 a.m. to 5 p.m., 5 days a week. We have a consumer help group. We have agent services help. So whether you're a consumer, agent, contractor, electrician, any of those things, if you have questions on building codes, insurance, you name it, just give us a call or go to the website, ncdoi.com, and we will do everything we can to help you. And I'll be around for a few minutes, but then we've got to go visit some fire departments around the area. So thank you all for being here today, and it's all yours, Melinda. Thank you.
Thank you.
Appreciate it. Okay.
Commissioner, thank you so much. I'll tell you, I've had the pleasure of working with the commissioner for a couple of years, and sadly we don't get to see him that much. As you heard, he travels across his state so much, and we're so grateful for his service. What you're going to find today, I know you're all rip-raring and excited to learn about Medicare, right? Yes! It's confusing, isn't it? And what a great thing to have such a wonderful resource here and additional ones across the county to help you with that wonderful stuff. One of the things that we are so excited about at SHIPP, and I'm not going to change the agenda, but because I'm going to introduce my counterpart here in just a moment, is the collaboration between the departments within the Department of Insurance. So with that, one of the things we're very excited about is the connection with the Office of State Fire Marshal, and you heard the commissioner talk about the fire departments and so on. But also included in that is injury prevention, and a big part of that is Safe Kids. So you think of getting car seats into automobiles correctly, but another part of that is injury prevention and something called Operation Medicine Drop, which affects all of us. So it is my distinct pleasure to introduce to you Shannon Bullock. She is our injury prevention deputy director with the Department of Insurance, and she's going to share some great information with all of you and talk to you about these red bags that you got.
Hey, good morning, everybody. So first, thank you, SHIPP, for giving me just a few minutes to be able to talk to you about some of our programs that we have at Injury Prevention section and with Safe Kids North Carolina. How many of y'all have medications at home right now that you don't need? Does anybody? Yeah. So do you know where to get rid of those medications? Do you know how to get rid of those medications? Yep. So most of you do. Do you know there's permanent drop boxes all over the state? We almost have 250 of those permanent drop boxes that you can take your medications to 24/7 on most occasions. But first I want to go over real quickly, I don't have much time, but I do want to go over what our problem is. So the opioid epidemic is not only a national issue right now, it's also a North Carolina issue. An average of 4 people per day are dying in North Carolina over overdoses. And these are unintentional overdoses, and 48% of those are from prescription opioids. So the opioid problem is a huge, huge issue in North Carolina. So we need to make sure if we have any of these additional opioids in our homes, we need to get those out of our homes. In 2016, the data showed us it's the first time in many, many years that overdoses, unintentional overdoses, has surpassed motor vehicle crashes and fatalities and injuries. And that's huge. So we have way over 1,500 deaths a year just from overdoses and opioids. So Operation Medicine Drop is just a partnership between the Department of Insurance and many other agencies, specifically law enforcement, just to make sure that y'all have locations to get rid of your medications. So I was told just this morning that you have permanent drop boxes in every police department in the county, except for what place? Manio, except for Manio. So at any of your law enforcement facilities, you can go and drop off your medications free of charge. And when you drop off your medications, we incinerate those for you. So then we know that we're eliminating these medications in the best way possible. If you flush them down the toilet or you put them in the trash, they're going to get in our landfills, they're going to get in our waters, and we're going to eventually digest them at some point. So we just want to make sure with the Operation Medicine Drop that you give us your pills, we'll take care of them, you get them out of your home, you keep kids from getting into them. Most teenagers say that they do get medications from their family member. So they could be going into their grandma's house or their grandpa's house or their sister's house and getting these medications, and no one knows anything about it, and they could be getting medications that they don't need. So my plea to you is to just please give us your medications, bring them to an Operation Medicine Drop. If you don't know where one is, let us know. We can help you find one. Our website at safekidsnc.org go to permanent drop boxes. You can find all 250 permanent drop box locations. Last year in spring campaign, we have 2 take back event campaigns, one in the spring and one in the fall. So in our spring campaign last year, we brought in 24 million pills in one campaign. So that's just 6 months' time. So that is a lot of medications out there that we need, that are still out there that we need to make sure that we're getting. So since 2010, we have collected over 130 million pills. That is a lot of pills that we have incinerated. We want to keep incinerating those pills and keep getting them out. So with this, we gave you a little goodie since y'all allowed us to come today, and we really appreciate just having this few minutes to talk to you about Operation Medicine Drop. And there's information how you can find permanent drop boxes in here, everything that you need. This is a medicine bag, so you can keep your medicine in here if you travel. And again, if you need anything from us, just let us know. But before, I wanted to split my time a little bit because I do think that we have so many different programs to offer that often Medicine Drop is one of our better programs, but we also do fire prevention. And we do cooking safety, CO safety, falls prevention. There's a lot of different programs that we have that could benefit all of you. So I brought with me Jan Parker. She's our fire prevention specialist for the state. She's the one that is the most knowledgeable on fire prevention, and she's just going to give you some quick updates and some quick tips that you can do to make sure that y'all are safe for fire prevention. So thank you.
Okay, thank you so much for giving me just a minute. I have spent a 40-year career with the fire service. I was with the Raleigh Fire Department, and then I was honored to be able to come over to work for the state with the Office of State Fire Marshal for the last 10 plus years. And I can tell you that fire safety is something I'm very passionate about. Fire and fall prevention and our senior adults, because we know that every day fire departments across this country respond to home fires, and many of those are preventable. I mean, we know that on an average, 7 people die every day, and you can reduce your risk. And in your little red bag that I think is wonderful, you'll see a tip sheet, and it has 7 fire prevention messages and 8 fire and 8 fall prevention tips. So there are things that you can do to reduce your risk at home, and I hope you'll take time to read that, because some of them, maybe I challenge you to do something to make your home safer. It could be putting handrails on each side of the stairs, putting extra lighting, being sure that your smoke alarm is working. That is just so important, because by having a working smoke alarm, we know that you can reduce your risk of dying in a home fire by more than 50%. And that's pretty good, isn't it? And technology has gone so far that now you can have smoke alarms that have sealed-in batteries that are good for 10 years. And that is wonderful, because nobody has to risk a fall trying to get up there and change the battery. They still need to be tested. And did you know that the life of a smoke alarm is only 10 years? So if you think your smoke alarm is more than 10 years old, you need a new one. And one of the programs we have at the Office of State Fire Marshal, we have a smoke alarm program. At the present time, our inventory is very low, but there are programs throughout the state where fire departments can apply for grants and get smoke alarms to help the high-risk communities that they serve. So remember that as well. But we do have programs, and we even have train the trainer programs for a program called Remember When, and this is so important for you to know about, because it's fire and fall prevention. And you probably could all tell me a story about a relative, a family member, or a neighbor that has been injured from a fall. It's almost an epidemic, really, because as we age, and thank goodness we're living longer, we want to stay in our homes and be independent and be safe, so we really don't want to have a fall that really gets us in trouble. So there are lots of things you can do to make your home safer for the fire and fall safety. And I had a quick little question I was going to ask you, because this sort of ties in. Which do you think kills more people each year in the United States? Would it be shark attacks, lightning strikes, or carbon monoxide poisoning? Carbon monoxide poisoning. And this is we call it the invisible killer. And in your little red bag, there's also a safety tip sheet for you to check out that is called the invisible killer, and it talks about things you can do to be sure that you're safe. Faulty heating equipment, cooking equipment could be what causes carbon monoxide poisoning. It reminds us simple things like never to have a generator in the house or the garage, never bring a charcoal grill into the house or garage, but that you need the ventilation. And some people just, you would be surprised, they forget or they just aren't thinking, or they think, well, my garage door's up. It reminds you not to crank your car and warm up your car in the garage, even with the door open. So these are some things that might seem common sense and simple to you. Fire Prevention Week is every October, and every year we have a new theme. This year it's going to be look, listen, learn, be aware. Fire can happen anywhere. And it reminds you to look around, look for things that could cause a fire, for fire hazards in your home. And then listen to the sound of the alarm and make sure all your visitors, your family members, grandchildren, everybody knows the sound of your smoke alarm. And then learn 2 ways out of every room in your home, especially the bedrooms. Be sure your windows and doors can easily be open. And then once out, stay out, and make sure everybody knows a safe meeting place out front so that when the first responders arrive, they can see you and know that you're safe. And if they don't see you, they're going to maybe assume that you're in there. So it's really important for you to practice this. And we're there. We have a website that has great materials, and your community is very important to us, and we want to serve everybody. So if we can be of assistance, if we can answer questions, we can call. That's why we have injury prevention specialists in each region of the state. And thank you for your time.
Thank you, Jan and Shannon. I'll tell you what, I learned something every single time. I didn't know about the 10-year with the smoke alarm, Jan, so thank you for that. I always think about changing the batteries. I just don't think about changing the actual smoke detectors. So, well, wonderful. Well, I hope so far we've shared some good information with you. So for the meat of today, we want to talk to you about SHIP and Medicare, and I'm very fortunate to have 2 of my colleagues that are going to speak to you more specifically about some topics. But what I wanted to talk to you about today is just SHIP in general, and talk to you about something very big that's happening in the Medicare world, the new Medicare cards, okay? So let me start with this. How many of you have heard of the SHIP program before today? Excellent, 2 people. So what I think I'm so proud of in terms of North Carolina is that we were one of the very first SHIPs in the country. It started in 1986 right in the Department of Insurance, and it came as a result of a number of older adults calling about questions regarding their Medicare supplement plans. And the Consumer Services Division, as the commissioner was speaking about earlier, was relaying a lot of these calls. And people knew about the Medicare supplement plans, but didn't really know a lot about Medicare because Medicare is federally regulated. So he, along with our previous SHIP director, created the SHIP program. It started with 2 people, folks, and they went from this state from end to end, and they recruited volunteers. It really was, and it still is, a grassroots effort. And I am so proud that today we have at least 1 coordinating site in every single county. And fortunately, the ones that I mentioned earlier here in Dare County, a place that people can go and get that help that they need. Because I can say this, do you think that you see the same doctor as the person you're sitting next to? Probably not, right? Do you think you take the same medications as the person next to you? Probably not. Did some of you retire from from different places of work, and maybe you have retiree benefits from your previous employer? Maybe you had them before and they've decided they're not giving them anymore, right? Everybody's situation is different. So there's not a cookie cutter answer for every single person. And our great SHIP staff and the volunteers are all trained to help you navigate this crazy, difficult process. Because it can be overwhelming, right? For years, I'll tell you, my father, who passed away a couple years ago, my mother passed away long before, he was actually in the insurance business. And I would work with him when he turned 65, And I would say, Dad, we need to go over your prescription drug costs, right? Your medications every year. And he'd look at me and he'd say, Melinda, it's fine. The one I have is just fine. I don't need to change anything. And I said, Dad, but you need to look at it. Because what can happen? If any of you have been on Medicare for a while, those premiums can change every year, right? The drugs they cover can change every year. The medicines that you have been prescribed can change from year to year. The pharmacies that you can go to with these plans can change from year to year. So it's nice to know that I hope that you have a resource locally that's free. It's unbiased. We don't steer anybody into a particular plan, to a particular company. I mean, we have no stake in the game at all, just merely to provide support to the people of North Carolina. Last year, let me start with this nugget. We are such an aging state, which is great. Who wouldn't want to move here, right? Especially to the Outer Banks. So right now, we are at 1.9 million Medicare beneficiaries in this state. That's pretty astounding. And here in Dare County, it's about 5,100, and I imagine that number is just going to continue to grow, okay? So with that, they said statistically in the next couple of years, we're going to have more people in North Carolina that are over the age of 65 than are under the age of 18. That's pretty amazing, isn't it? So how fortunate for us at SHIPP to be able to support this great, wonderful population and be an additional resource. So I mentioned to you 1.9 million Medicare beneficiaries, Last year, the SHIPP staff and the volunteers across this state, we helped almost 100,000 people. And that sounds like, golly, in comparison to 1.8, but believe me, that's a lot of work, and we were so proud of that. And we saved consumers over $60 million, and that is actual dollars that we can prove that we saved. And people say, how on earth did you do that? Well, just by helping people compare plans. So I'll give an example. Does anybody here have to take a brand name for a medication? In any circumstance, right? What's the push anymore? They want you to take generics, don't they? And getting you to take the brand name can be going through hurdles, right? And it's challenging to navigate. So there are a lot of plans, these prescription drug plans that are offered through Medicare that may not cover a brand name drug. They may cover it this year, but maybe not the next year. Or one may cover it and it costs just a significant amount of dollars, but another one it might be less. That's something we can help people with. We use a Medicare website. We put all the medications in, the dose, the strength, how frequently you take it, and it actually will generate information back to say, this might be a good plan for you based on what you're taking, the pharmacy you use, and it can save an exponential amount of dollars for people. Last year, we had somebody that had hepatitis C that came into our office, and the medication that they needed to take for hepatitis C was, I think it was $30,000. And they were on a drug plan that didn't cover it. So we were able to get them into a drug plan that did cover it. They still had out-of-pocket costs. I'm not going to tell you they didn't, but we were able to save them a lot of money. So, and it could be even something, that's on a grand scale, but you even think of one that maybe costs $50 on one plan, but it's $25 on another. I don't know about you, but $25 means a lot to me in my pocket. And I'm sure it does for everyone else as well. So it's getting to be that time of year. I know Lisa's going to talk more about this coming up as well, so I'm not going to take her thunder away. But every year between October 15th and December 7th is the time that you can review your Medicare information. Soon enough, you will all be, for those of you that are on Medicare, you should be getting your new Medicare and You handbook. And that's going to be mailed to most of you. And following with that, if you're on Medicare right now and you have prescription drug coverage or a Medicare Advantage plan, they'll be sending you that information. It's called the annual notice of change. And again, they come in these big packets, right? And do you know what I do with a lot of those? Yep, just put it aside, right? So, and then you start getting a ton of information in the mailbox from this plan, this plan, this plan, this plan. How nice to know that you have a resource available that can help you navigate that and hopefully put that stuff away. One of the big changes, as I mentioned earlier, in the Medicare world, is that new Medicare cards are coming. So the current Medicare card has your name on it and your social security number, right? And what did we hear the commissioner talking about earlier? Fraud, right? I mean, that social security number is tied to so many things in our life. So fortunately, the federal government has made a big change in this, and they are coming out with new Medicare cards. North Carolina was WAVE. Our cards were just being mailed beginning August 20th. So what will happen is every single person that's on Medicare is going to get a new card. If you are married, it's possible that one of you will get it 1 week, the other one may not get it for a month or so. There's no rhyme or reason as to how they are sending these out, okay? One of the things that is very different, in a good way, the numbers have, they're randomly selected. So it's a number, an alpha, numeric, I think it's 9 numbers long. So with that, when you get that new card, you're going to hear from, when you get the information, they're going to say destroy your old one. And I'll tell you, from our perspective, we're saying don't destroy it yet. Make sure that when you present your new card to the doctor, because you're going to do that, that things are moving well in the system. Put it away, put the old one away for a little bit, but then you'll start getting those Medicare summary notices and you'll make sure that every payment is going through and being processed correctly, okay? With that fraud and with the new Medicare cards, sadly, you guys, there are scam alerts and fraud alerts that are coming at warp speed. It's so sad how much we get this information every single day. Social Security will never call you. There is no cost for you to get this new card. There is no cost for you to activate this card. It's automatically activated, okay? You can laminate this new card. There's nothing on this card that's going to be an indicator that someone could steal your identity. That's a good, important piece too. So has anybody in the room received their new card? Great. Okay. Have you used it yet? Have you brought it to the doctor? Anybody? Okay. Well, good. It's good to know that this is coming down the pike. So with that, I am going to just close by saying I am so grateful that all of you came today. And if you are not receiving SHIP services, if you haven't saw this out before, please feel free to do so. You can certainly reach out to Emily and Brandy and the folks that we mentioned earlier, Olivia and Kuritak. We have a toll-free number. There's information going about that, and the commissioner mentioned it earlier, that you can contact us Monday through Friday from 8 to 5. We have great information on our website. For those of you that have family members in other states, there's a SHIP in every single state. So I always like to point that out too, because there are folks that I would be considered, I guess, my parents were snowbirds, so going back and forth with that too. Lastly, just in closing, we're so grateful that you all came out today, and if there's any questions you have throughout, I'll be up here. But in the meantime, I am going to turn it over to my colleague, Marcia Kelly, and Marcia is our Southeast Coastal Regional Director. That's a mouthful, isn't it? Thank you so much.
How are you guys doing? Are you ready to go sleep yet, or are you engaged? It's awesome. We do thank you guys for being here today, and I'm only going to talk to you for a couple minutes on two things. One thing that's really, to me, is very, very important. When the Affordable Care Act came about several years ago, it opened the door for more preventive benefits for Medicare beneficiaries. And for Medicare, preventive benefits keeps them from having to pay for you when you're sick. So it's a win-win situation, really, but what they're really wanting to do is save money, right? They want to keep you well, so they don't have to pay for you when you're sick. They just want to save money. And I mean, we all want to save money. But those preventive benefits are so very important. And with those benefits, most of them are free to you. I mean, they don't charge you anything to use some of them. Some of them do have some copays, but the main thing is using them. And what we've learned over the past few months, and well, actually over the past year, is that these benefits are being grossly underutilized by Medicare beneficiaries. How many of you guys are using your preventives? Well, that's not very many hands. I'm going to wag my finger at you right now. Fellas, I know you don't want to go get your prostate exam. I get it, okay? I know that's not something you think about and you're like, yay, I'm going to go get my prostate exam. But it's so important because prostate cancer is very treatable if it is found early. And oftentimes they can cure prostate cancer if it's found early. So the later you wait, the worse off you're going to be. So please, go get that exam. It's a short period of time for the rest of your life, right? It's worth it. And ladies, I'm going to wag my finger at you too. How many of you have had your mammogram regularly? Good. I will tell you right now, a mammogram will save your life. I'm living proof. I was diagnosed with breast cancer in 2014, and had it not been for that mammogram, I never would have known I had cancer. And so it's very, very important to get out there, get that done. Granted, it's uncomfortable, it's awful, but it'll save your life. And there's so many of those, the list, I could go through the list, but it would take me all afternoon. I'm not going to do that. But there's a list a mile long of the things that Medicare will cover to make sure that you stay healthy. So I recommend highly that you use those benefits. The second thing I want to focus on is a program called Extra Help. Extra Help is a program that is designed to help individuals who have limited income, but who may fall outside of the Medicaid benefit. And these benefits are designed to help people who have low income that can't afford their medications. And in this area, I have to look at my notes now. In this area, there are 222 people who are eligible for this benefit. And that doesn't sound like a lot. In the state of North Carolina, there's about 80,000 people who are eligible for this benefit, but in this area, it's a smaller number. But that equals a lot of money when you start thinking about the program and what it does for people. Emily and Brandy and their folks, their volunteers here in this area, they screened 84 people last year for those benefits, and that equals about, if they actually are able to qualify for this benefit, that savings would be about $20,000 for those folks. And that's not chump change. That's a lot of money for people who sometimes worry about whether they can afford to go to the grocery store or to pay that bill. So it may not affect any of you in this room. It may, but it may affect somebody that you play pickleball with, or somebody that you know at church, or somebody that you go and have a drink with on a Saturday afternoon. So these are people, and they may not know that this is something that's available to them. So we just highly recommend that you get out there. If you just hear somebody say, you know, I really am struggling to pay my bills. Now you know. You can tell them there's a program out there with the Department of Insurance through CMS that will help you pay for your meds. And so just keep that in the back of your mind, and thank you guys so much for being here today. And I'm going to now turn it over to Lisa Barker, and Lisa's going to give you the rest of the story. So you guys have a great day.
Good morning. I just love it here, y'all. I'm one of the lucky people because the Northeast region, y'all are my folks. I come across the Northeast region. I have 23 counties, and I get to come to Dare County usually at least once a quarter. I try to talk with Emily and say, do you need me any more often? I just want to give a shout out to the SHIPP volunteers and the SHIPP coordinators that are here. I am so proud of the work that they do to help you guys. I was so happy to see so many hands go up when she said how many people know what SHIPP is. I hail from Wisconsin originally, so now you know I really like your area. But really, I think one of the things about SHIPP is that, you know, when you're working with people, my background is working with seniors. My background is working in senior centers since 1998. And so when I came to North Carolina and I started working with SHIPP, I knew that I wanted to help people. I started out as a volunteer. And for those of you that are here and are learning some new information today, if you have some free time, we would always love to have you come on as a SHIPP volunteer. We have SHIPP volunteers throughout the state of North Carolina. I, of course, have the best SHIPP volunteers. But some of the things that are coming, and I've been talking with the volunteers, I will tell you guys that my Dare Hyde County volunteers, that group of people, are the ones when I have to introduce something that I'm not really sure I'm ready to tell the rest of everybody else, I can come here because I have a pretty large group of volunteers, and they'll be honest with me. So I might not be ready to tell everybody, but I'm like, if I can get some feedback from that group of people, that's, usually we've got 16-ish people that'll be at a meeting, 10 to 20. They will give me the real feels about it. They will tell me, okay, how is this going to impact our seniors? And a lot of the volunteers are seniors that are helping out with SHIP here in Dare and Hyde County. So some of the things that are happening, we have quite a few Medicare beneficiaries from the raise of hands that I saw earlier. So we know that there is Medicare A and B, which is your hospital and your medical. There is Medicare Part C, which is an Advantage plan. And then you've got your D, which is your drug coverage, okay? For those of you that are staying later, I will go into great detail. We're going to do a Medicare 101, and we'll talk about those. Some of the changes that are happening that the federal government has looked at is expanding the services under Medicare Advantage plans to make them more cost-effective and make them more user-friendly across the United States. So we're hoping that what that will mean, instead of us having one Medicare Advantage plan in Dare County, hopefully as those different insurance providers decide to sell more Advantage plans across the region, they're going to be going out and educating the providers and then coming out and letting us know what they are as well, so that maybe there's some things that you could actually have dental or vision included, because sometimes with an Advantage plan you'll have that. There's also, that's one of the changes that is coming next year. There's some additional Advantage plans that might be available to you. Some of the other things, for those of you on the other end of the scale, Marcia talked a little bit about, for those people who struggle a little bit to be able to pay for their premium and their prescriptions. I would strongly encourage you, it doesn't hurt to ask. If you know somebody, I'm always like, go ahead and apply, and if you get a no, then you're in the same situation you were. On the other end of the spectrum, if you're somebody who has a great amount of income and assets, sometimes there's a larger amount assessed to your premium, and we have some information about where those are going to be, and the additional amounts are actually going down a little bit this year, which is good news. Premiums overall, we don't know. I think this year we've got 20, in this year, 2018, we had 26 prescription drug plans that were available. And I don't have all the information, and I won't until October 1st. But the overall premium is going down. So last year, the average premium, when you took the lowest to the highest, was $33.05. Or no, I'm sorry, $35.05. This year, it's going down to $33.90. So it's going down by a couple bucks. So, when you think about that, and you think, every $2 counts. Sometimes, somewhere, $2 is a gallon of milk. Not too many places anymore. So that's good news for us. The premiums are hopefully going to be a little bit less this year with prescription drug plans. Some of the other changes that are going to be happening in the near future is there's going to be some changes with supplemental insurance plans. So as you're going out and you're talking with people about plans, I think right now the most popular plan is Supplemental Insurance Plan F, because it's the most inclusive. There's going to be some changes with Plan F come 2020, and I think people are looking at more alternative plans, still a supplemental insurance, and something that they can afford, but it's going to come where it won't cover the Part B deductible, which this year it's $183. So they're looking at maybe Plan G or Plan N, Plan C. I know it's a little bit of alphabet soup, because when you're talking about Medicare, you're talking about A, B, C, and D, your parts. But then when you talk about supplemental insurance, you're talking about plans, and those are A through N with some letters missing there in the middle. So I'm trying to think. With some of the other changes that are happening, one of the things, again, kind of like what the ladies were talking about earlier with the medicine drop, Some of the reason that the changes that are happening with Medicare and them looking at expanding Medicare Advantage plans is in direct response to that opioid epidemic, okay? So some of the things that have now been signed and are being put into place, the reason they're looking at expanding Advantage plans, and this is my interpretation, is because they want to be able to do a little bit more case management, because they're trying to help people make sure that they're taking care of those medicines. So if you're on a Medicare A and B with a supplement and a drug plan, the other response that you could do is just make sure you're communicating with your doctor, and when you're going to dispose of the medicines that you're not going to use, there are these drop boxes that are out there. So we need to make sure we're utilizing the whole system that's available to us, okay? Anything that I've forgotten, ladies, back there? I know we had a big meeting on Thursday. I was just trying to think if there's anything big that I didn't bring up about the changes. I don't think there's anything major for next year, you know, that's going to cause anybody any great turmoil in regards to an increase in premiums or anything like that. We won't know in regards to coverage, and that's why it's so important. The dates that you always have to remember, either for yourself or for the people that you know, for coming in and seeing a SHIP counselor is October 15th through December 7th. That is, and I believe here at the Baum Center, they start scheduling appointments usually at the beginning of October to then take place between October 15th and December 7th. They've got a great team of people, and at this point they've told me they can handle all the appointments, so I don't get to come and help so far this year. So.
Lisa, they can use those red bags.
Oh, yes.
That you were given. Put your medicines in those, and then if you come for an appointment, just bring that bag.
Yes, that actually, thank you, Melinda. One of the things when we're doing SHIP counseling, when you come in, whether it's your first appointment to come in and see us, or it is your annual appointment when you come in and see us, we need your Medicare card, we need your medicine. We really would prefer you use the red bag or some other bag and just bring your bottles in, because, you know, sometimes we've written that list down, and well, the doctor's now given us 1.5 of those tablets, or maybe a half of it, or we've added something and so we've scribbled it at the bottom and we don't really remember what it is, but we've written it down there. So when you come in for that appointment to talk about what options are available for you for your coverage, bringing in your actual medicine bottles, your Medicare card, and then any questions. You know, I always encourage people when they're going to go to the doctor, especially if you don't have a second set of ears to go with you, to write down questions. So I think just like when you're going to come into your SHIP counselor, write down questions as things come up. If you don't want to call the 800 number because you know you're going to see a SHIP counselor the next week, you can certainly write those questions down, and we'll be happy to either answer them or find the answer for you. The other thing is, for those of you that took the Medicare Basics that was at the back table, and we will go over this in great detail at the Medicare 101, but on here is the SHIP 800 number, and y'all, a live person. A real body. You call and then you do have to push one number, but then a real body answers the phone. And that 855-408-1212 is the call center. And I actually do get to work in the call center a couple times during open enrollment. And let me tell you, those people there, as amazed as I am with our volunteers out in the community, the call center too. I mean, we just have some people with some really good knowledge there. The other resource that you can use in regards to with this Medicare Basics, it also refers you to the SHIP website. And one of the things that when I started as a volunteer that I started using right away, I would go to the SHIP website, but then inside here, when you are looking at supplemental insurance and you come in and see me, what I utilize this premium comparison database. So I think it's on that second page where there's some check marks there. So at the bottom of that, it gives you the website about the Medicare Supplemental Insurance Guide, and it gives you a pretty good estimate of what your insurance coverage would cost for supplemental insurance, whether you're going to go with a Plan F, a Plan G, a Plan N, some of those other alphabet in there. But this will give you, if you put in there male or female, your age, smoker or non-smoker, and it gives you a pretty good comparison. I usually say within 10% on here. And then when you look on there, you can either click on the hyperlink. I always encourage people when they're looking at supplemental insurance and what they want to do, if they have a connection with an agent, go ahead and talk with your agent, because you're going to want to, you know, if you want somebody that you can walk through the door and have customer service, absolutely talk with that person. There might be discounts available if you have, you know, some additional insurance with them, or maybe as a couple you both have your insurance with the same provider. You do not have to have the same supplemental insurance provider as prescription drug plan provider, okay? So you might have Aetna for your supplemental insurance, and you might have Envision for your prescription drug plan. You know, it's just different things. If you have a Medicare Advantage plan, you cannot also have supplemental insurance. That's a one or the other thing, because a Medicare Advantage plan takes over and manages your Part A, B, and D. Okay? I know that's a lot of information. So with the most important thing that I want you guys to walk away from here, three things. I want you to know open enrollment October 15th through December 7th. That's when you need to make sure you either call the 800 number or you come in and see somebody at the Balm Center. The other thing is I want you to know the 800 number. It's 1-855-408-1212, and it is in the printed information. And I also want you to know that no matter what county you are in North Carolina, all 100 counties have a SHIP counseling site. So you can, if you're not sure where yours is, or maybe where your friend or family members is throughout the state, if you call the 800 number or you look on the website, we can give you some direction in regards to where you can go. Well, I think with that being said, I'm the last person on the agenda before lunch. So we will wrap it up and go have some delicious lunch.